day everyone, my name is Trishanji Martinico from BSN 2D, and today I will be performing nasogastric tube feeding. A nasogastric feeding tube is a special tube that is inserted through the nose for delivering of nutritious supplements and medications into the stomach. As a nurse on duty, I am required to feed the patient that is based on the schedule. Take note of the time and the type of oral nutrition supplement and the amount needed. So, the equipments are the clean gloves. Tube feeding solution, the towel or the disposable drape, the 50 ml bulb syringe, the graduated cylinder, a jug of water, the pH strips, and a small bowl, small cups, lubricant, tape, medication, or any feeding schedule. The feeding schedule will be given upon the discharge. So, the first thing to do is hand washing. We should sanitize or wash our hands with soap and water and then provide patient's privacy. Check the patient's identification card for verify their name or the date of birth, and then explain to the patient the procedure. Put on clean gloves and then drape the patient to its chest to provide privacy. Put the patient up at least 30 degrees in position. And then get the lubricant. Put it in your hands. Then get the tube or the feeding tube. And then you must lubricate it to get easily through its nose. Go through. Then this tube will go through the patient's nose, then its nostrils, to the esophagus, up to the patient's stomach. After you put the tube, you must ask the patient to open his mouth for you to be able to see if the tube is not coiled inside. Open your mouth, sir, and let me see the inside. Okay, it's good. It's not coiled. To check if the feeding is in the stomach, we must withdraw some gastric content with the syringe. If you're unable to get the gastric content, lie the patient on their left side and then inject 10 to 20 ml of air onto the tube and make another attempt to withdraw gastric content. Lie the patient and then put some air. To 20 Okay. If you're still unable to obtain the gastric content of the patient, wait for 15 to 30 minutes and try again And if you're already taken it, read the gastric content pH level. If the pH level is below or equal to 5, then the patient is ready to be fed. So this is the gastric content of the patient. Patient is already ready to be fed. Please take note that the pH levels can be affected by the certain medications as well as proton pump inhibitors, H2 antagonists, and antacids. If the patient is on other medication, please check with your doctor or pharmacist as they might also influence the pH results. The next step is feeding oral nutrition supplements. Check the feeding schedule, then prepare the correct amount and oral nutrition supplement prescribed. So feed according to the supplement that is prescribed by the doctor. So prevent air entry to the stomach by kinking the feeding tube before once connecting the syringe. And then flush with 20 ml of water or as per prescribed. And then feed according to the prescribed medication. After that, we must position the syringe above the head, and then the syringe is not empty to minimize the stomach discomfort. Then flush 20 ml of water or as per prescribed to complete the medication. And then close the feeding port with a stopper. Ensure that the recommended external length of the feeding tube should be measured and consistent during feed. The feeding tube should be secured firmly to the nose or to the cheek by a tape. Next is feeding medication. Ensure the right medication is being prepared and then crush the medication finely or to dissolve it with a lukewarm water. Connect the syringe without the plunger to the cake feeding tube. Before feeding the medication, flush the feeding tube with 20 ml of water or as per prescribed. And then put the medication or as per prescribed in the syringe. Patient should remain seated for at least an hour to prevent gastric reflux. So you should remain seated. Precautions are: do not mix the medication with oral nutrition supplement. Administer feeds prescribed by your healthcare professional. Consult your nutrition nurse specialist for other options that do not cause the blockings. Use only water-filled syringe and then apply pressure to the plunger to flush and unblock the tube. And then after that, we must do the hand washing and the aftercare. And that would be all. Thank you.